Hello again. This is Paul Riga, assistant professor here at the University of Toledo, the Department of Emergency Medicine and the Department of Public Health and Preventive Medicine. I'm a physician, emergency physician, and I want to introduce Dr. Gada Murdad from Saudi. And we're going to be talking about the second act of this mass casualty incident with regards to the arrival of the first in phenomenon, or the first responders as they come in with their roles and responsibilities. Take it away, Gada.
Okay, so as we mentioned before, that in any scene, in incidents, each hospital should be prepared for the first wave phenomena. And as we see, that the first wave phenomena, they just reach the hospital because they're able to mobilize, they're able to walk. So hospitals should alert themselves, especially the emergency medicine room, to prepare themselves that there is another next phenomena are coming. So who's the first responder? It's the ear. As we see the air, there's an ambulance with first responders who came to the scene, and from here we can say that this is the beginning of the inborn of the incident command system, which is used and it's very successful to manage all disasters. So from here, we have two personnel from the ambulance, from the EMS. Usually, one of them will be the triage officer, and the other one will be the command post. And what are they doing exactly?
Okay, well, you're asking me?
Yeah.
Oh, she's asking me. Okay, fine, okay. Well, essentially, basically, this EMS person is going to, number one, make sure the scene is safe. Okay, and for the purposes of this discussion, the scene is safe, but that's a key issue, is the scene safety. So this EMS person is going to be going to the scene, ensuring that the scene is safe, but then evaluating the patients.
What's the meaning of safe?
Safe in terms of there's no hazardous materials around, there's no gasoline leak, there are no fires, okay, it's not a terrorist incident, things like that, okay? So that it is not a potential threat to the responders. Going to be the triage officer, and he's going to be assessing the situation. How many victims they're located there, and the types of injuries that they are facing. Okay, that's basically what he's going to be doing. We'll talk about the actual triage process at a later point. This fellow, however, is going to be essentially the interim incident commander, and he has a number of duties that he has to provide dispatch when they have a response from the infrastructure to take care of the situation, because he's got to contact EMS, fire, and law enforcement. Do you want to talk about those a little bit more deeply there, Gada?
Yes, actually he's the one who's going to talk to the dispatch, inform the dispatch how much he needs as a law enforcement, as an EMS, as a fireman. He's the one who's sizing the scene and give the information, the first information. And also, from one of the important issues, that he can actually tell them where to go, where to come, and where to go. It means he will decide where's the ingress, as he decided here, that you're going to make the ingress through the west street, that this is the way they will come, and the egress toward the hospital, where they're going to transport the patient towards the north, from the north street. So he's the one who's going to tell them where to come, where to go. He's assessing the safety, he is assessing the scene, how much he needs needs efforts, he needs like help from other dispatches. Anything we should need to do?
No, that sounds perfectly right. And because there have been times, there have been situations where there have been mass casualty incidents where rescue vehicles will come in from multiple areas and kind of bang into each other, and ingress and egress are kind of like all confused. And so they can't get in, they can't get out. A key aspect of this whole business is law enforcement, because they will set up a perimeter around the disaster site to prevent people from coming in who don't need to be in there, and they will direct the traffic, and they also provide security. So these are key issues, okay? The first in phenomenon, this is kind of like a chess match, okay? The better you get your people in place and functioning appropriately, then the better your middle game is and the better your end game is. You screw it up in the beginning, and the whole thing will be screwed up entirely, okay?
Yes,
you want to finish that up?
Yeah, this is a very important thing, very important aspects in disaster management, and a lot of a management of big scenes, big events, which is how to make a team that is coordinated very well, very organized, under incident command, and we will talk about this in details later.
Good.
Okay,
That's
thank
it.
you.
Thank you.